If you ever had a back pain or pain in your side or flank, it is possible that it could have been kidney stone. It is like delivering a baby. It is colicky, very severe, and it is one of the most painful and intense experience anybody could ever have. In this video, I will discuss what are the causes of kidney stones, what are the symptoms, what are the risk factors, how are kidney stones treated, and what you could do to prevent it. We will tie this whole talk together in the end. So stick around. What is kidney stones? Kidney stone is a crystallization of minerals, salts in the kidney system or urinary system, which involves renal pelvis, ureters. Those are the tubes which bring your urine from your kidneys and connect to the bladder, and then through urethra you pee it out. You must create favorable conditions in this conducting system or genitourinary system where these crystals can be formed, precipitate, and can lead to kidney stones. If you chemically analyze these stones, they are of primarily four kinds, and fifth them has a genetic basis. The most common ones where you could make impact calcium oxalate stone. If you do not know chemistry of your kidney stone, primarily you could bet on it's probably calcium oxalate stone. Second is calcium phosphate stone. Number three is a uric acid. Fourth is truite. Those are the stones which have primarily a lot of ammonia in it, and they are the one which are made when somebody has repeated infections. The fifth kind is cystine stones, for which there is a genetic basis. How we form them. When these crystals, salts and minerals, they get in the urine, and once they reach threshold of critical concentration, they precipitate and make kidney stones. So if we break down this process of making stone, it will depend on not only on calcium, phosphate, uric acid, or oxalate, it also depends on the local environment, which you and me have a lot of influence, which we will go over. We need to create favorable conditions so that these can mix and match and can make stones. If we understand to prevent that happening, we could prevent kidney stones. Symptoms. Number one symptom is severe colicky pain, which is in the back, and it can radiate to your lower abdomen. It could go to tip of your genitalias. It could go to inner side of your groin, depending on where the stone is moving. If the stone is primarily in the kidney pelvis, the pain is primarily abdominal and lumbar. When it comes to the upper third of the conducting tube or the ureter, it is pretty much the same. In the middle, it starts going to the groin. The lower part, it radiates to your pelvic area. Second symptom, which is very, very common, is that this is not a constant pain. This is a colicky pain. As I said, colicky pain is like delivering a baby. The pain comes, intensifies, reaches crescendo, and then comes down. Then the waves start over and over. You could have blood in the urine. That's not a rule, but most of the time you will have it. If the blood is too much, you will have a frank blood. If there is a little bit of leak, you could have a pink urine and red urine or brown urine, depending on the concentration and how long it has been going on. Next is frequent urges to urinate. If the stone is distal, you have a difficulty in passing urine. You will be very nauseated. Red flag sign, that is one thing out of this video I do not want you to miss, is fever. If you have severe abdominal pain, which is colicky plus fever, that is a medical emergency. Do not ignore, ask for help, and get yourself tested and treated. How do we diagnose kidney stones? Kidney stones primarily is a history and physical examination, but testing wise, we will do CBC test, which shows whether you have active infection or not. Second is a urine analysis. As I mentioned, you will have microscopic or macroscopic, meaning little bit or a lot of blood in the urine. Also, we will do urine culture to rule out infection. But a radiological test of choice is CAT scan of abdominal pelvis. This is a very simple test. In this, you don't need any contrast. It's without contrast and it could be quickly done. Give you the information not only about that you have kidney stone, it will give you information about the size of the stone. That is very important. Size of the stone determines the further course of treatment. If your stone is less than 5 millimeters, it will hurt you the same, but the chances are with the proper hydration and relaxation and pain medication, you will pass the stone. If the size is between 5 millimeter to 7 millimeter, it is iffy whether you will pass or not. But you will definitely do not pass the stone out if the stone is 1 centimeter and above. Real problem is if your stone is big and it gets stuck in the ureters and you don't pay attention, it will lead to backpulling of urine in that kidney and you could lose your kidneys. That is very important that you don't ignore. Further, if it gets infected, I've seen people dying from urosepsis, meaning overwhelming infection due to these causes. It will not get better till you relieve the symptoms and you remove the stones. It is, I think now with this background is a good point to discuss different kind of stones which we started the discussion in the beginning. Calcium oxalate stones, though they are number one, they are very common. See two component calcium and oxalate. American diet is sometimes deficient in delivering required amount of calcium. Once you eat diet, it goes to your gut. In your gut, calcium and oxalate both bind. You pass it on in feces. But if your diet is deficient in calcium, then there is a large amount of oxalate left in your gut or small gut, which can be absorbed, brought down to your kidneys. If you're dehydrated, that is where in higher concentration calcium and oxalate will meet. That will lead to calcium oxalate stone. That's one mechanism. Or if you have a medical condition which improves or increases the absorption of oxalate is primarily all the inflammatory bowel diseases. If you have ulcerative colitis or a Crohn's disease, that will lead to high oxalate load and you are at increased risk to develop stones. If your diet is very heavy in processed foods, meats, salt, soda pop, you will absorb these oxalates a lot more than normal. You will have increased risk of making stones. Calcium phosphate stones, they obviously you need calcium and phosphate. You need to avoid high meat content because phosphate is primarily in the muscle, and then high meat content diets will put you at high risk to develop calcium phosphate stones. Also, uric acid stones, because purines in these muscles or the meat that gets converted into uric acid during metabolism and lead to uric acid stones. If you have repeated infections, which is very rarely these days we get it because screening techniques have gotten better and people are very apt to get it treated, but we have seen very big, thick strua stones. What are the general recommendations to prevent kidney stone? This is not a rocket science. That is something you, me, everybody with or without kidney stone should be doing it. We must not get dehydrated. We must hydrate ourselves. A recommendation is 2.5 to 3 liters of water drinking every day. If you have medical condition, consult your doctor, but that is a rule of thumb. Prevent diets which are high in oxalate. Those are spinach, chard, rhubarb, almonds, peanuts, chocolate. They are very high in oxalate, so prevent them. Don't eat too much of sodium. Prevent high animal proteins. And if you have genetic disposition, make sure you see your physician. What can you do or how you handle kidney stones? I have covered part of it is it depends on the size. If you happen to have a CAT scan and you know the size, less than 5 millimeter, you could manage at home, provided you do not have a fever. Drink plenty of water, take ibuprofen or other medication to help relieve your pain. There are some medication which we use for prostate, like tamsulosin. They open up the ureters, they improve the diameter of the ureters. You could pass. Larger stones are treated usually with the shock therapy. We deliver sound waves which breaks these stones. Sometimes we have to go through your urethra with the scope, and your urologist will locate it, bucket it out, and leave a stent over there. And if the stone is too big, sometimes we have to put external tubes into your renal pelvis and drain it and remove this part. If you are serious and you want to prevent kidney stones forever, these are the practical tips which you must follow. Drink 2.5 to 3 liters of water every day. Limit sodium intake to 2 to 3 grams per day. Eat moderate amount of calcium. Increase citrate in diets with lemon, oranges. Watch for oxalate intake. All these things which you put together, you should be able to prevent kidney stones. In this video, I wanted to cover how we make kidney stone, what are the symptoms, what you should know about the size, red flag signs, and how you could prevent these kidney stones. I hope this video was helpful. We have created a playlist for kidney stones, different aspect of kidney stones. We will link it up in the cards. Like, share, and subscribe to our channel. This is Dr. Kundlas signing off. I will see you in next video. Thank you.